So, very warm good afternoon and very warm greetings to each one of you on behalf of the Indian Association of Physiotherapists. And I'm Dr. Sumant from Digital Media Team. And very fortunate that today we have Dr. Rachna Gupta as our resource person and Dr. Ruchi Jain, who is the moderator on such an important topic, which is impact of COVID-19 pandemic on special need children and preparedness for next wave. And we are fortunate to have Dr. Ruchi Varshney, who is our National Women's Head and a great supporter. Because of Dr. Ruchi Varshney and our President, Dr. Sanjeev Jha, because of them, we've been able to have this digital platform and have that freedom to actually share the knowledge and exchange the knowledge. So great thanks to our entire CEC and very thankful to IAP Madhya Pradesh for bringing up this such an important topic, which I feel is the need of the hour. And before wasting time, I would like to just tell you people that we would be going live on our IAP India YouTube channel. So people can share that link. I would be putting that link on the chat. And I would request there would be certain informations which we would be sharing in between and towards the end. And now without wasting time, I hand it over to our moderator, Dr. Ruchi Jain from Guna. Over to you, ma'am.
Thank you, Dr. Saman. Thank you so much. IP Women's Cell District Branch Guna is organizing this webinar for the current pandemic of COVID-19, and especially as a mother, as a parent, I too am concerned about the third wave preparation and precautions. So I was very worried when this thing came into my mind, and it's really, really a blessing that Dr. Rachna Gupta ma'am gave us this opportunity so that we can hear from her and learn from her. Dr. Rachna Gupta ma'am, very, very warm welcome from our side. And let me introduce you to the IAP India and IAP Women's Cell. Ma'am, this Indian Association of Physiotherapists is a big platform for us to unite at one place. And some 3 years back, our national head, Dr. Ruchi Varshney ma'am, took the initiative to start up with a women's cell. And because of this women's cell only today, we are learning throughout this COVID. I guess from last 14 months, I remember, we are continuously learning in this online platform. And this is the big step of the Ruchi Varshney ma'am, of course. Thank you so much, ma'am. And I'm very, very honored that you joined us for this webinar today. So I would like to hand over mic to you so that you can welcome our guest of the day today.
Thank you, Ruchi ma'am, for your very kind and wonderful introduction. I'm humbled and honored. And thank you to, first of all, our resource person, Dr. Rachna Gupta. She's a very leading practitioner, and in such difficult times, she has taken this valuable moments out of her busy schedule for our participants, for our physios, for the parents, basically, because we all are scared, we all are in dilemma. What is going to happen? The second wave was totally, unexpected. We have lost our friends, colleagues, family members. And in this difficult period, the second thing which I would like to appreciate is the efforts of IAPWC team, Guna team, IAPWC MP, Madhya Pradesh team. They all have been very, very, pillar for this education, this period. Otherwise, it was so gloomy. Everybody was in pain. Everybody was so sad. There was nothing around. Students were in mess. How they will go ahead with the education for 2 years? They didn't have proper classes. But I would like to inform each and everyone here, and ma'am, Rachna ma'am as well, that we are running continuously series of webinars where our esteemed resource persons from not all across the country but across the world, they are sharing the knowledge with our students, with our physios. We already have, IAP has issued the guidelines for this COVID-19 period, because we have a very important role in the preventive stage, in the curative stage, as has been proved this time, that physio and chest physiotherapy is doing wonders. It's doing miracle for the patient. So we have issued guidelines for the acute care and for the post-COVID rehabilitation, which now the government has understood also what is the importance of physiotherapy and cardiopulmonary physiotherapy in this wave. So not wasting much of the time, I would like to also add on that we are running, ma'am, IAP helpline in the various states. It's a multidisciplinary helpline where right from the intensive care specialist, from physician to pediatrician to psychologist, physiotherapist, dietitian, everybody is working together. And IAP MP has also started. So I am sure that they will coordinate with you to, just we can do a little bit for the society what this time. And that's the only thing we can do, otherwise we all are helpless in front of this COVID-19. But thankfully every physio is trying to contribute whatever they can in their own capacity. And thank you so much, ma'am, once again to be the resource person for our webinar. Thank you, Ruchi ma'am, for your invitation. So thank you. And thank you, IAP digital team. Very thankful. We have done, ma'am, more than 1,000 webinars in this 1 year.
Yes.
And we all are doing it just voluntarily, free of cost. We are not getting any remuneration for it. And thank you, Dr. Suman. Meaning when he was not well also, then that time also he never said no for any webinar to host. So this is the spirit actually which keeps this momentum alive. And I hope we all fight together this COVID-19 also. Thank you so much, ma'am.
Thank you so much, ma'am. Thank you, ma'am.
Thank you.
Now the time for the introduction. I know whatever I'll speak about our speaker it's like a flame towards the sun. But Dr. Rachna Gupta, ma'am, she doesn't need any introductions. She's a fame. From अगर मैं मेरे शब्दों में बोलूं, because I'm working with her from last 15 years, और उनके एमपी लेवल के जितने भी स्पेशल किड्स होते हैं मैक्सिमम मेरे पास आते हैं. एंड जो भी पेरेंट्स उनके पास से यहाँ आते हैं वो यही कहते हैं कि उनसे मिलकर लगता है कि हम उस बच्चे की माँ नहीं है, वो उस बच्चे की माँ है. इतना मदरली एटीट्यूड, इतना मदरली केयर वो इतना प्रोवाइड करते हैं कि इट्स ऑलवेज अ ब्लेसिंग टू बी विथ हर. Dr. Rachna Gupta ma'am has done MD, DNB and MNA, MS from pediatrics. She has done her graduation from State GS Medical College, KEM Hospital, Mumbai, and DM Pediatric Neurology from AIMS, New Delhi. Wow. And she has done her fellowships from Epilepsy and Electrophysiology Fellow, Cleveland Clinic, USA, Neuromuscular Disorders Training, Institute of Myology, Paris, Neonatal EGILAE Fellowship, Cambridge, UK, ILAE Fellowship, Pediatric Epilepsy, San Salvolo, Italy. And she has wrote more than 10 book chapters and more than 20 publications in different categories. That means a lady with a brain, beauty, passion towards work, and passion towards enlightening the education path. Thank you, ma'am. Thank you so much. You are here to bless us with your words. I will not waste much more time because we have so many queries. Here we will be having many physios and parents too for this webinar, so that everyone get felicitated with your words. So, ma'am, please, over to you. Yes.
Thank you so much. Thank you. I should say Ruchi square here. So I am meeting two Ruchis in one day, and wonderful listening both of you, especially the work which you all are doing, especially for the students and the parents and the online work which you have kept on. Otherwise, yes, I agree, this was very gloomy period. And Ruchi, thank you for that flowery introduction. And I know I'm just one of the normal you actually. And I'm really great fan of physiotherapy, team and the people I work with, and it's excellent. And I really feel that we are kind of incomplete. Our department is incomplete, if we are not working with you or if we are not in collaboration with you. And I'm really thankful to both of you and also Indian Academy of Physiotherapy. So let me move on, and just at outset, it's almost a disclaimer that I have kept very few slides so that it can be more interactive. See, the whole issue with COVID-19 is that all of us know a lot, and all of us are being thrown so much information every day that at times we feel what is right, what is wrong. So always a discussion and question answers could be more useful, but still I wanted to put some facts and figures just to give a start to this topic, right? So let me begin. Let me know if you face any audio or video related issues. So as you can see here, almost two parts of this presentation, impact of COVID-19 pandemic on special needs children. I have tweaked a little bit, and preparedness for the next wave, whether we call it third wave, fourth wave, because in between little bit of small insurgents we have been seeing. So these are the talking points roughly, how the pandemic has changed lives of children. I have written children here because we all know in our families and friends and extended families that all children are affected, and more so special needs children. So whenever it comes to children, I should say, like, it's in whole, children and special needs children. How has it impacted locally and globally? Are we, like, doing worse, better? What measures people have taken, or professionals have taken, or parents have taken, or have we been able to do something related to this impact, and how we should prepare for the future waves. So this practically sums up what we'll be going through. Now coming to, like, very important question, how the children and their lives have been affected. First point, as you can see here, many of us really don't believe this, that children are also, like, getting infected since the very first wave itself. The whole issue here is that since most of them get a milder infection, so their issues are not coming too much forward in terms of number, and also the severity is much less. So saying that, children are not getting affected is not a good statement. So yes, of course, infection itself is also affecting them. Number is it's less, and severity is less. But yes, they are getting infected. Physical growth getting hampered. Their physical, also, pre-existing conditions if these patients have, maybe cardiorespiratory or neurological, those are the ones who will be getting more serious illnesses and more severe manifestations and ICU admissions. And children who have chronic ailments, they are affected in dual manner. First of all, their routine care and routine visits, which were there regularly to the hospitals and multi-specialities, have been stopped. Most of the hospitals and most parents and professionals do not have a pre-existing online consultation facilities. So there was a discontinuum in their care. And obviously, these are the children which are much more affected. So their disease itself, and the problem related to infection, and the difficulty in getting support from the healthcare system. Number two, when we come to socioeconomic effects, it has been tremendous, because we know children are very unique, because they have their need for their growth, they have need for their education, their learning. And someone who has reached their adulthood, we know that we have already achieved in terms of, some professional efficiency and our academics, but children are still in their growing state. So anything which is happening socioeconomically in a manner which is affecting their learning and education gives a long-term impact. And food and nutrition and education are first to get hit. And obviously supportive care, which are much more in demand for children of special need, are the ones which are affected, I should say, first, because those are the ones which get little less visibility and little less representation, even when things are normal. So even when things are normal, people are thinking less about underprivileged children. So the moment there is moment of crisis, of course, these are the ones which are hit first. And something which we are thinking little less about is the long-term impact of all this, like burden of disability, children who are getting undiagnosed and underdiagnosed, children who are not getting enough support in terms of early intervention in first 2 years or 3 years, which they should be getting. So the ultimate burden which we might be facing in coming decades of low level or high level disability could be really tremendous. This is something which I just picked randomly just to show us that what happens to an average day-to-day earning family to their economy whenever there is lockdown. So we can see here that whenever there is a lockdown, there is a complete flattening of curve. And whenever we see something like this, we know that the needs of this family are reduced to only a bare minimum food. So they're thinking about education, learning, taking care of special needs children. Everything goes backwards. Something which I want to put here again is this is a slide from UNESCO website where they say if we see overall the school closures, how how badly it has impacted the whole world. So we can see countrywide school closures. We can see India very prominently here. I have put school closure slide here just to remind ourselves that when normal children are getting deprived of what they were getting every day, thinking about children who need physiotherapy, occupational therapy, special health, special education, and their outdoor activities. So special needs children are much more affected compared to the usual days. Other things which have taken a toll on children routine care is immunization, survival, domestic violence. Obviously, whenever economy is going down, the women and children face domestic violence.
Dr. Rachna, we are unable to hear you. Dr. Richi, can you please check with Dr. Rachna? Is there any technical?
Yes, I'll just call. I'll just call her.
Yeah, thank you. Yes, she's joining, I guess.
Hello.
Yes. Yeah, we are able to
Yeah.
hear.
I'm sorry, there was.
Yes,
Yes, ma'am. Now you're audible.
Sorry, yeah, I'm sorry. Actually, there was some disruption due to storm in the area, and there was some disruption in the internet. So I have changed my internet. Is it audible now? Is it audible?
Yes, ma'am. It's
Yes, ma'am. It's audible.
And do I go back to the previous slide or not required? That was done.
That was clear, ma'am. You was just about to finish. Yeah, this was clear.
Fine, perfect. So children with special needs, when we come to, especially, what is their requirement and where they are getting affected. As I was saying, that they need umbrella care. That means they are multi-specialty, multiple professionals which are involved. And in most of the cities still in India, most children are going to different centers for different kind of therapies and help. It could be of any frequency, once a week, twice a week, depending on how it is being scheduled. So that has been disrupted greatly. Isolation, being at home all the time. So most of these children do get some respite when they are going out into the playgrounds, meeting other children, going to normal kids. Their outdoor activities is completely shut. Parental stress, anxiety, and quality of life is deeply disrupted. There are multiple hundreds of publications on parental stress, anxiety, and quality of life, especially of parents of children with special needs. So in general, also parents are undergoing special stress, but in this category, a lot of publications, even from Indian cities and Indian psychological societies. So parental stress is mounting up, and obviously it comes back to the kids somehow or the other. Lastly, I have written here, a lack of infrastructure and acceptance of virtual methods. So unfortunately, we as community, we as professionals were never prepared for something like this. And we had never told our patients or our children, that there could be a way where we are not going to the facility, but we are still getting benefited. So the system was not in place. We were not mentally prepared. So it came almost like a culture shock to us the moment we say that there could be something which could be done virtually. If we take some examples from places like Japan, China, or Singapore, and the way they have picked up in terms of their school education, in terms of therapy, in terms of giving back to children with who need special care help, they were able to pick up very fast, and most publications are saying that they were able to make it up very well. Unfortunately, very few centers had such facility, and I remember when I was in AIMS, we had a telemedicine center. It was most neglected, not most neglected by the authorities, but most neglected by the students, people working there. And we were like, so how can it help? We are sitting and taking knowledge from each other, why we need to move to telemedicine. And that time we were not realizing that we were at AIMS New Delhi, but there are people who are, in the other places in country and could benefit with case discussions, with other things. And it was almost forced upon us that you have to do this. And this period, I realized, what was the need of those things. And while we were always told that patients who are coming from Bihar, Andhra Pradesh, or other places or different countries, they should be given option of a virtual consultation or online consultation. But unfortunately, neither we were prepared nor the patients were prepared. Even they were kind of uncomfortable that how will you see us on video? How can you observe? How can you examine? So yes, there were lacunae and gaps, and we did pay price for that initially. And in fact, we kept telling ourselves that the things will be better soon, and we did not develop it. Within few months, we'll be all back to normal, and why to do this just for some period of time? And we had wave 1, we had wave 2, now we are talking about wave 3. So obviously now people are really thinking that this is the way forward. This is a very important slide, I should say. I guess most of the common people and most people are not aware that children with COVID-19 can have a lot of impact on their muscle, nerves, and on their brain. And trust me, in last 1 year, I have seen practically each one of these. And since the draining area of Indore is limited, so I'm sure there are many more such cases, and everyone could be seeing them possibly. So children who have pre-existing epilepsy, or even if they don't have, they can have seizures. Epilepsy patients can have worsening. Guillain-Barré syndrome, peripheral neuropathy, Bell's palsy, other cranial nerve involvement. This is a one group altogether. Then coming to directly encephalitis, encephalopathy, and ADEM, acquired demyelination, which is also very commonly seen. So I should say, since I see only neurologically affected children, still this was a big number. Because I know in routine days how many cases of GBS we see, how many cases of ADEM we see, and there was definite increase in number. So since the first wave itself, we were seeing children it is happening in other parts of the world as well, that they were having neurological manifestations of COVID-19. Stroke, all types of stroke of major vessel and small vessel stroke were risen greatly. I have never seen those kind of strokes in last 15-20 years the way I saw in last 1 year. Almost like adult pattern of stroke related to coagulopathy, which is because of COVID-19, muscle involvement and myositis. So this is this is other than fever, minor illnesses, pulmonary and lung involvement, and multi-system involvement. This subset is only representing here how the brain, muscles, and nerves can get affected in COVID-19. This is the first few teleconsultations last year when we adopted in the hospital. And you can see I was so happy myself. This was in April itself, April 2020. And this is a child who came for follow-up of an antenatal stroke. And I could see him very well. He was smiling at me, and I could see his hand functioning and everything. And slowly, I was convincing myself that teleconsultations are fine. I can ask for a lot of videos. I can tell parents, make this, make that, send them to me. I can review it. I can ask for some more thing and get suggestions from them. And this child was a patient of epilepsy and also some cognitive issues. And you could make them read, you could make them write, you could see practically everything. And on the other hand, I could see their home environment, which was an added advantage, I should say. So I could see all that. So teleconsultations in some patients and subsets have been boom. Patients who are already diagnosed, patients who were for follow-up, many things I could see online and virtually. So as I was saying, preparedness and lack of existing system, which we face terribly, hesitancy from both the sides. Not all the consultants were ready for teleconsultation. Some would say blankly, I don't like it and I won't do it. And many are doing that still. So frankly speaking, at times we feel like, we should be trained in the beginning itself for this so that we know how to handle it if we are not able to see our patients physically. And it has been a slow process. It has been a very, very slow process technically on the patient side and also from the professional side. Let's see, I guess over a period of time, I feel for some patients, once we know that this is the way and this is the format of virtual follow-up and this is what we should be following, most patients and most professionals should agree to this method itself. Now coming to safe practices. Whenever there was some opening up, most patients would prefer to come to you physically. And as we know, children with special needs do need some touch, some comfort, and some handling. So obviously, there has to be safe practices. Fortunately, in our environment, the kind of mask, the kind of hygiene, and the kind of entry of the patient was provided. Thankfully, everything was safe, and we were regularly checked for COVID-19 RT-PCR so that we are not giving it to the patient and we are not getting it from the patient. So thankfully, last 1 year, I have worked without any infection and practically every day. And also, I would like to share here that the myths about fomites and surface are, I guess, over-exaggerated. And generally, we do keep like wipes and other things to clean the fomites so that the fomite contamination is not there. The sheet is changed. The hands are cleaned regularly. But wearing gloves and you feel that anything you are touching and this will be infection, that's not correct, I feel. So scientifically, even by CDC and other guidelines, it has been proven that mask and distancing wherever required. And surface contamination could be overplayed and over-exaggerated. So I could see that kids who want to cross this wall and come back and sit on this chair and write something. So intermittently, it was allowed to them. So I could say I was breaking few of the protocols here of the COVID-19. This is again something which is, I would like to share. In the distress times, whenever we see families helping children with special needs and how everyone pitches in. So I find siblings' role in a great way. So I just want to play these over here and just want to show you that these are two sisters, how they are helping children with special need in their day-to-day work. What I want to emphasize here, other than the parents and therapists, right from neighbors, right from grandparents, and siblings' role comes in great way. And sometimes children could be more compliant to siblings than the parents. So just watch here. I hope you're able to see this. So this is a child with severe autism spectrum disorder, and how the sibling is helping to recognize alphabets and fix. So in fact, this was a teleconsultation actually, and she was showing me, and she sent me the video. And this is how when I see them at the clinic. So this was non-COVID days when the siblings came with the affected child for consultation. And you could see here also that how a sibling is guiding, almost like a special educator here. So in fact, I always believe that all these special children are really blessed because, you know, they get someone or the other to help them through. So these are like, you know, the little sparks which we have to see who can help them. And I always talk to the siblings if they are involved in the care of the child. And at times they ask me questions, how to handle this when this happens, or when he's not listening, how to get attention to. Now the very important and something, you know, which we all are like, you know, very, very anxious about is third wave, so-called third wave, I should say. See, whenever there is any pandemic which is related to something respiratory like coronavirus and COVID-19, what we are seeing, we will be having something which is happening because after each wave, there is a vulnerable population which is left. Vulnerable means someone who's not got infection and someone who's not vaccinated. So that cohort becomes a vulnerable population and becomes the raw material for the next wave. So obviously we'll be left with a vulnerable population after this second wave. And since children are not vaccinated and children are not infected in a great deal, they are considered that they will be affected in third wave greatly. If you ask me frankly, not only me, Indian Academy of Pediatrics and American Academy of Pediatrics guidelines, children are relatively less affected in any ways. And I will come to the reason why in the next slide. So those fears could be like overdrawn, I should say. Number two, coming to the vaccine status as far as pediatric age is concerned, as we know, pediatric patients and children respond very differently as their immune system is different. Not that we cannot vaccinate them. Yes, we can vaccinate them. Most vaccines, in fact, are for pediatric age group only, and they are tried and tested in them. Now, as it comes to COVID-19 vaccine, first trials were done in elderly. So to extrapolate the same dose and same safety data in children is really difficult. So what we are seeing right now is like Moderna and Novartis, they are already doing trials for children of different ages. I should say under 12 years, they are still in pipeline, but above 12 years, vaccinations have already been recommended in Europe and also in US, especially by Moderna. So Pfizer, Moderna have already given I go ahead for about 12 years. When it comes to Indian setting, I am happy to inform you, I guess most of you would be aware that Covaxin, above 4 years, they have started trials for above 4-year children. So we will be having dosing guidelines, safety guidelines, and for different subset of age groups, like what happens to 0 to 2, what happens to 4 to 8, what happens to 8 to 12, and that way. So unfortunately, pediatric age group is not even one group. So even under 12 years, we have subgroups where the dosing and the duration and the safety guidelines could be different. So we all should be awaiting those patiently, and hopefully in a couple of months, we could hear something from Covaxin that above 4 years, we could be starting to vaccinate them. Something which I have written here in the end, multi-system inflammatory syndrome in children. This is a very, very unique COVID-19 complication in pediatric age group, and one of the serious ones, and was reported in April itself from UK and US in great numbers. And in India also, we are seeing these children who come with rash, who come with liver, cardiac, and kidney involvement and shock. Most of these patients require hospitalization in ICU and also ventilatory care. They can have their muscles and brain involvement as well. So this is one of the most severe COVID complication in children, and unfortunately not uncommon even in our setup. So even in Indore pediatric intensive care units and world country over, the ICUs are seeing a lot of children with MISC. And this remains a big challenge because, again, the treatment is costly and most patients are critical in this subset. I was just talking to you that how children are different and why we see less severe infection in them. And I'm sure all of you are aware the entry gate of COVID-19 to the cells of the body is through ACE2 receptors, ACE2 receptors. So, and we can see here that if we represent all this as a COVID virus, which has orange spike 2 protein, so the orange dots are spike 2 protein, and the blue part on the cells is the ACE2 receptor. So the spike 2 protein is binding to ACE2 receptors and it gets internalized. So the more amount of ACE2 receptors you have, more virus can enter your body. So this is how we have even genetic heterogeneity, that someone can have more severe infection, someone will have less. And thankfully, children have less ACE2 receptor expression on their cells. So this is one very good and scientific explanation why children have less disease, less severe disease, less pulmonary involvement, and why less number of children are having symptomatic diseases. So this is not going to change even with third wave. So our apprehensions could be really, overjudged, I should say. And so most of them have milder diseases. Pulmonary disease, the lung involvement is also on the lesser side. They have less hospitalization. As I mentioned, multi-system inflammatory disorder, which is very, very unique in children, that is one of the serious involvement, and also the neurological involvement. So this kind of sums up that what happens due to COVID-19 in children. I have practically summed up, the difficulties people have faced during this period, how we have tried to pitch in through telecommunication and telemedicine and connecting to children again, and what are the gaps, especially the children with special needs are facing. And I'm really emotional presenting this slide over here. So this is a 17-year-old girl with autism spectrum disorder. And she really loved colors and she was drawing practically every day. And almost two to three times a week, I would receive something from her, bright colors and nice, and it would make my day. And I had these slides more to present to parents, as a motivation for children with autism, etc. Unfortunately, we lost her in this COVID period. And this was one of the videos which the brother made, for me, whenever I was presenting for something. So this was very, very unexpected. And she lost her life last year. So what I'm trying to mention here that teenagers could be almost be behaving like adults. So they could be having serious disorders, they could be having illnesses, they could be affected with other illnesses which are less attended during the COVID period. So thinking that children have not been affected at all and they have been totally safe in first and second wave is not the right thing. Yeah, much less and milder. And in third wave also, there is no reason why we should think in a different direction, because possibly we could be having vaccine, we'll be able to handle and vaccinate them better. Thank you so much. So this was a kind of a brief opening up to the topic, and it is vast and huge. I would like to end this presentation, the formal presentation, I should say, because I'll be taking question answers and queries and comments. I guess this slide practically sums up that whatever we are facing, at the end of the day, it doesn't matter who's stronger, who's richer. The only thing that matters is, are you happy or not? So even in this difficult time, it remains a challenge that people who are around you, people who have trust in you, your family, and people who attend to you, give that share of happiness always, and be ready to do that always. Thank you so much. Thank you.
Thank you so much, ma'am. That was really very, very wonderful to hear all the basic things about COVID. And seriously, now, as personally, I feel we are overly reacting towards the third wave. It's very clear, and you explained it very simply. There is nothing to panic about the wave because our children are blessed with so many self-generated immune power boosters. But we have few questions here, like already some parents dropped to me before we started up. One question was like, are these kids allowed to go to the park to play because they are facing some emotional concerns too? And because of this, some ASD there is increase in autism spectrum disorders. Is it so?
I shouldn't be saying that because of pandemic there is increase in autism spectrum disorder, but yes, children who could be subsymptomatic, who were not overtly symptomatic, have become symptomatic because of excessive use of gadgets, not allowed to go outside, and a fixed routine and a fixed area in a small space. So children who were already prone to autism, they got more overtly, they started presenting with the symptoms. So directly, no. Indirectly, yes, a big yes. Now, can they go out and play in park? हाँ, जा सकते हैं, लेकिन पार्क में खेलने का मतलब हमेशा ये नहीं होता that you have to be close. See, open area is always a blessing. So whenever you are in open space, the chances of infection are much less, much less. So the distance and a mask. Parks are generally big areas. So someone you have your own family children. They are at home also, they are in the same space. So even in park, if they are playing in one area in the same place, it is no extra infection. So this is what I always tell. And there are always timings where the parks or the public places are little less crowded, like early mornings or late evenings. So always try to find out the timing where there are less people, number one. Number two, try to be with the families or friends where you check regularly. It's almost like you can say a bubble, right? Where
Right.
that this is your family, no one is sick, and you are using your mask and your hand washing and care properly. So basically, that kind of safety, if you maintain, then you are allowed to having party and going out. All those have been the biggest source of infection. But I have seen so many people in the park regularly jogging, regularly going for cycling, and I haven't come across that somebody doing all this have become positive. No, not really.
Right,
But
right.
sitting and eating together, right? Talking together loud, all those are big
Right.
issues. So
Big issues.
laughing, talking, singing, right? All this throws a lot of virus at the other person. And especially once the infectivity rate comes down, then with safety, obviously all these can be done. All these can be done.
Right. Right. Even I think if kids are going to the park and increasing physical activity, these things again safeguard them more, right?
Exactly. Let me tell you something. Whenever we see children, we have something like, get up from a chair and walk test, or a 6-minute walk and all that. So when you look at children who have been in lockdown, their muscles have gone weak, and obviously their lungs have also gone weak. So they are not ready to take any infections, really. So if they are not physically active, COVID hits muscles like anything, right? So
Right.
you are not ready to take any virus or any infection if you have been at home all the time and sitting all the time. So keeping yourself physically fit, keeping your lungs fine is one of the priorities. So in any ways you can do it. You can do it within the home. You can do it outside in the park with safety. Wonderful, wonderful. It should be promoted. With safety,
Right.
it should be promoted. Yeah.
Ma'am, we have a question in the chat box. Ms. Nachwala is asking,
Yes.
doctors are suggesting for flu vaccine before the
Hmm.
COVID vaccine arrives,
Hmm.
not Indian scenario. Should be done or not?
I should be very clear in this matter. See, flu vaccines were always recommended for children with chronic illness like asthma, heart disease, neuromuscular disorder. So So children who have Duchenne's muscular dystrophy, all sorts of muscular dystrophy, cerebral palsy, who have poor lung volume, their flu vaccine should always be there, COVID or no COVID, every year. But for normal children and normal people, flu recommendation, I should say at this point of time, could be overrated. Because as such, even flu vaccine, when you're taking it for the first time, are 2 doses 1 month apart, right? So if you have never taken flu vaccine in life, you take one now, you take one after 1 month, and then it starts working in you. So I don't think we are trying to achieve anything. People who have initially qualified for flu vaccine with chronic diseases, they should be receiving their flu vaccine as recommended.
Right. Okay, and ma'am, is there anything related to special care of seizures and fits in special kids if they are having increased episodes of seizures? So we have to take care of vaccination during vaccination and during treatments too?
Yeah, this is a good question actually. See, frankly speaking, whenever children have had fever, which has been like viral and possibly COVID, I'm saying possibly COVID because the sensitivity of RT-PCR in children is very, very poor because of the process, the logistics, getting it inserted and taking a swab properly. So less than 50 to 60% sensitivity. That means many a times when you are getting high-grade fever with myalgia, many of these patients actually have COVID, which is presenting like a viral fever. And these are the patients who can present with increased number of febrile seizures. So this has become almost a known fact that fever with seizure could be COVID actually, patients who have never had seizures ever, okay? That's one. Number two, patients who already have history of febrile seizures could be at a higher risk for a breakthrough seizure. And same is true for patients who have pre-existing epilepsy. So 3 categories, right? So febrile seizure and epilepsy patients can have a breakthrough seizure. 2, and someone who has never had seizures can also have seizure with this fever because at times the fever is really high grade, 104, 105. So it's almost a marker, very, very high grade fever, myalgia, mild rash, and a seizure could be actually COVID. So in children, we are using antigen, we are using serology to confirm if the RT-PCR is negative. And CT test is not frequently asked for because of the radiation dose. So try to be as less towards CT test as far as possible, especially if oxygenation is maintained as normal.
Right. And one more question is there from our one of patient, it is said in present scenario, virus is in the air. Is it true? What to do?
Virus is in the air means it remains in the air for a while, right? So it's not incorrect that it's not in the air. It is in air. And unfortunately, we took it so long to understand, right? So that is the reason the closed spaces are more of a problem, right? But it loses its vitality after a while, right? So even if it is in the air, its vitality is not so much. So if you are asking about kids to play in open air, wherever there is open air and a flowing air, I should say that it's a safe environment.
Right. Perfect. Because if air is moving, there are less chances of infection, and moreover, ACE2 receptors are lesser in kids now. So our kids are safe. And we have one more question. What precautions should we take while treating?
I'm sorry. One more thing. Please take masks very, very seriously. They work and they work. We have seen it. Our whole team has seen it. So people who have worked with COVID patients constantly have maintained themselves negative constantly just with use of good masks. And use double masks when required. Yes.
Fine. One more question, ma'am. What precautions should we take while treating special children in our clinic as they don't wear masks? This is Dr. Sakina, ma'am. You're there. You should ask it of your own now. Your central head, I was waiting for you. You changed your name. So Dr. Sakina ma'am is there, our central head of IAP Women's Cell.
Yes.
Yes.
Hi, Dr. Sakina. Hi. So I can see that. I can see that question of yours. I guess this is very, very important question. See, when I see a child with special need who's not wearing mask, like I shared two photographs on my presentation, I know they are not wearing mask, right? So in such scenario, the best is that people all around them should be wearing masks with proper safety, right? See, the possibility is that this child could be infected and is throwing in air, okay, for whatever brief time you are interacting to the child. But at least you should be protected. You're getting what I'm saying?
Right.
Yeah. So if you have, like, I know I have sometimes visited COVID ward. Okay, we have to visit COVID ward because all these patients do get admitted in COVID ward. So none of them is wearing a mask. None of them is wearing a mask. So it's like, we are protecting ourselves. We are wearing PPE and we are wearing masks. They are known COVID patients who are throwing millions of viruses in air, and we go in front of them when they are not wearing masks, right? So these are kids with smaller lungs. My suggestion is please keep your protection to the 100% and tell the parents that don't take child anywhere where people are not wearing masks properly.
Right.
Right?
True. Right, ma'am.
So
that's very true.
in my cabin, other than that I have a glass shield. Parents should be wearing masks properly. The child is allowed to take out mask when I start to examine. As soon as I have examined, they put back the mask, especially for a bigger child. Smaller child or an infant is not wearing a mask, but the parents and anyone else has to wear a mask properly. Or even I have to wear a mask properly. Yeah.
Right. We as caretakers, service providers has to be on the safe side, and the parents too. And one more question: does sanitizers harm our kids more? Because it's lots and lots of use of sanitizers, and even I feel giddy whenever I used to go to clinic and regular use of sanitizers are there. Even I'm practicing with teleconsultations since COVID arrived, and very rarely I used to visit clinic. But whenever I visit clinic, I used to feel giddy and dizziness because of the sanitizer. And then I think
my advice is don't replace hand washing with sanitization.
Okay.
Okay, so hand washing is better than sanitization. Sanitization is only when you are in a place where you don't have a wash area.
Okay.
Right.
Perfect.
And for the object, since I give them sometimes cubes, I give them sometimes books to read. So for those I use wipes and spray. Otherwise, hand washing is always better from one patient to another or before you touch any of your things.
Right, that's true. Fine. And ma'am, one more thing. I just came across a clinical case. That child of 2.5 years, he was all good before Feb. He got fever, high grade fever for 2 days. And after that, he is presenting with ASD, autism spectrum disorder. So, and there are changes in MRI too. So if this is because of COVID, is it reversible, or the child has to suffer with this for the whole life if COVID is the cause?
See, this is very, very interesting. See, because COVID is giving a lot of immune related and post-infectious phenomena. So if all this has happened following COVID and MRI is also showing changes, then this should be treated and this should be reversible.
Reversible.
COVID related, let me tell you, whatever I listed out there, encephalitis and other things, all these patients, almost 99% of them were treated and fully recoverable. Only one patient of stroke, she was 14-year-old, and first time I have seen that her whole one side ICA was totally blocked. So she required intervention and she's left with hemiparesis, but she's ambulatory now. Okay, so she also started walking in 2 years or 2 months or 3 months. What I'm trying to say that children are getting neurological involvement, but they are getting better with immunotherapy. So even myasthenia related aggravations, all immune related phenomena we are seeing. So even cerebellar ataxia and all those things are coming up, but they are treatable. They are treatable. But we have to prove it that this is related to COVID. So doing a COVID serology, checking the MRI, is it fitting into COVID-related disorder, and the treatment accordingly. My suggestion is pure autism related to COVID, no. But yes, immune-mediated behavioral issue and autoimmune encephalitis-like phenomena, yes, and this is treatable. And autism doesn't have anything on the MRI. So if this child has MRI abnormal, then it has to be something post-COVID.
Right, post-COVID must be there. And one more question is, do we have to take more care of post-GBS patients if like patients had GBS history some 2 or 3 years back? So do we need to take more care in respect to COVID?
Definitely. All patients with neuromuscular disorder. So since they all have some or the other, like, in terms of their lung capacity, the vital capacity is always on the lower side. Most GBS patients have had something minor or the other, and so definitely they have lungs which are already compromised. So these are the patients, even if they get their 10 or 20% lung involvement with COVID pneumonia, they will be on the worst side. And since COVID gives independently muscle involvement also in a pure myositis form also, so the weakness will be more. If they have some existing milder weakness, that will become more overt, and the recovery from pneumonia will be delayed. If they are ventilated, then also the recovery is delayed. So yes, neuromuscle disorder is a special group, and they should be vaccinated as soon as possible for COVID.
Right, right. So we have to take special care of special kids, but our kids who can play outside and increase their physical activity and can complain about the hygiene and unhygiene are at safer side, right?
Yeah, just one comment. Things simple like running, jumping, and cycling. You don't need 4 or 5 kids doing together. Like,
actually,
they can do it at distance, and they can build their muscle strength, stamina, and lung volume. So all that should be allowed. All that should be allowed.
Right. Perfect. Perfect. Thank you so much. So, Dr. Suman, do we have any questions on YouTube?
No, so far everybody is just appreciating. I think.
Okay.
Yeah.
So I guess we are done now with all the questions I had and we had in the chat box.
Great, great.
That was really an honor, ma'am. Your words are really wisdom. And I just hope, and I'm full of confidence, each and every physiotherapist and all the parents must follow all your tips, and they must take care of their kids more than they were, and in a safer manner they were. Thank you so much. Your valuable time means a lot to us. Thank you so much.
Thank you. Thank you in regards to all of you. Thank you.
Thank you.
Thank you, ma'am.
Thank you so much, Dr.
Thank you, IAP Digital team. Thank you so much for your so well executed webinar and all technical support you gave us throughout. Thank you, Dr. Suman. Thank you, Dr. Prabhati. Thank you so much.
Thank you.
So we'll see you soon.
Yeah. Thank you. Thank you so much. And thank you, Dr. Rachna. I would just like to request, I have shared the links with you on the chat. People who would like to have the COVID guidelines, management guidelines, which have been issued and prepared by entire IAP team, can be downloaded. And I would also request to subscribe on IAP India YouTube, Facebook, Twitter, and Instagram pages. And thank you so much for your kind participation. And thank you to all the participants as well.
Thank you so much. And excellently and very well conducted meeting, I should say. Not a webinar, right?
Thank you. Thank you so much.
Thank you, ma'am. Bye. Take care. Take care.
Bye.
Thank you.